I'd like to welcome you to this meeting of the Wabash Valley Lean Network. If you don't know about Wabash Valley Lean Network, it's 125 member companies throughout Indiana and the surrounding states. We focus on process improvement using lean principles and tools. Meet one morning per month in Lafayette or Indy. We've got 6 meetings scheduled over the next 12 months for Bloomington, and we meet 4 times a year up at Valparaiso. We make sure we have time for networking and have great presentations where you can learn about lean and process improvement. To sum it up in 4 words, I like to say, learn, share, meet, and improve. What's really exciting about our meeting today is this is the first one we're doing with the Uplands Lean Network in Bloomington. We're actually broadcasting today out of Bloomington at the mill just off campus. So we're going to have Chuck Russo talk a little bit about the Uplands Lean Network, how they came to be and what they're trying to accomplish in the Bloomington area. And not to forget our friends up north of Valparaiso University, 4 meetings a year there. Great hosts. It's a little smaller group, but very enthusiastic, and we've had some great sessions up there. Agenda for today. Like I said, Chuck's going to talk about the Uplands Lean Network. Then we're going to have a panel discussion discussing the impact of COVID-19 and lean and process improvement and continuous improvement, what they've done to adjust and what tools they'll continue to use post-COVID-19. Our esteemed panel is Joe Voss from Cook Medical, Mary Burday from IU, and Chuck Russo from IU Health. We'll take some questions and hopefully have some good answers for you and do a short wrap up, and we'll call it a day. That was a picture from our pre-COVID meetings. But we've got a lot of new folks on here today. Maybe aren't familiar with lean or process improvement. So I want to just talk a little bit about why do we even care about that stuff? Why is it important? Well, we're all facing brutal competition. We're being asked to do more with less resources. Our customers have more and more choices. Competitors are bigger than we are. They seem to have more money to spend. We're all trying to do more with less. Why should our customers even pick us? And we're all being asked to produce better quality, faster, better results, but it's got to cost less. That's tough to do, especially year after year. So how do we do all those things? Well, many of the best companies in the world are using lean principles and tools to improve their processes and their organizations. Lean in one sentence can be sort of summarized as providing value that the customer wants and doing so with the least amount of waste in the organization. So providing value to the customer, least amount of waste in the organization. Can't argue that. Lean's based on a philosophy, and it's got a number of different tools you can use to meet your goals. Where did it all start? Well, it actually started with Toyota auto plant in Japan after World War II. They got it going well. Other manufacturing companies in Japan copied them. Pretty soon, manufacturing companies all over the world were copying them. Healthcare was a early adapter of the lean principles to their business, and it's now used in almost all industries. You say, come on, all industries? Well, here's just a list of different industries in the Wabash Valley Lean Network. And if your business doesn't fall into this list, I guarantee the lean principles will still work. We've already got a team in place. We know what we're doing. We're different. You know, this doesn't apply to me. No. Here, not to name drop, but here's some of the companies within Wabash Valley Lean Network. This is just Indiana. And these are some of the companies and organizations you know. But we've got a lot of mid-sized companies, a lot of smaller companies. How does Wabash Valley Lean fit in this? Well, we have the monthly meetings, or since we've got Valparaiso now and Bloomington, almost 2 times a month meetings. It's a great way to interact and network between members at the meetings. Where else are you going to meet up with people who are fighting the same battles you are? And really, it's coming together to help, teach, share, help each other out. the best we can. Again, that whole lean, share, meet, improve. And the age-old question, what's in it for me? Will leaders drive improvement within their organizations, in their teams, and themselves? Lean can help you do that. Lean process improvements often listed on new job postings. Lean and process improvement experience on your resume is a huge plus. And lean thinking can make your job easier and help simplify your personal life. I always like to have this slide in my openings. If you can't describe what you're doing as a process, you really don't know what you're doing. That was from Dr. Deming. And with that, I'm going to turn the mic over to Chuck Russo from IU Health, and he's going to tell you a little bit more about the Uplands Lean Network. Chuck?
Thank you so much, Doug. I really appreciate it. And it's great to be here. We're actually at the Dimension Mill this morning in Bloomington, Indiana. And our host, Andy Lehman, has very graciously offered this space for us to meet here. You might hear a little echo in the background. That's because we are all very socially distanced together in a large room. But I want to talk a little bit now about the Uplands Lean Network. Kind of just give a quick overview. Andy, if you could go to the next slide. Andy was very gracious to kind of put together some graphics and a brand for us. But just to talk a little bit about the inaugural meeting of our Uplands Lean Network. I've had a lot of people ask me, why do you call it Uplands Lean Network? And so I figured I would just kind of break it out for you. And you can take a look at where it comes from. The first word is uplands, and that really describes the geography of Indiana that we live in. So we live in southern Indiana. So the uplands region starts just north of Martinsville and goes down to the Ohio River. James Alexander Tom has a great description. And the Lean Network really, if you look at our reason for action, that kind of describes it well. We want to have a vibrant regional network. We've got people interested in continuous improvement. We want to increase awareness, improve understanding, and create value at the individual, organizational, and community level. And we really want this to be a community resource for those people and practitioners in Southern Indiana. Next slide, please. Just a little history. In 2019, we had a group of organizations in Southern Indiana that met to discuss the formation of a lean network. You can see who they were there. We got organized, we set up a schedule of events. Actually, we had a quarterly face-to-face schedule that we were planning. And we decided, I think very wisely, to partner with the Wabash Valley Lean Network. Really what we want to do is build a statewide lean organization. So we're an affiliate of the Wabash Valley Network. And so we think there's going to be some nice synergy there. A little thing called COVID hit last March. And so that kind of interrupted our plans. But we are now back better than ever. And in 2021, we have 6 virtual events planned. And you can see what the calendar is there. We're planning them for an hour each, and really we want this to be impactful, but also easy on your schedule, because we know a lot of you spend a lot of your day on Zoom meetings or WebEx or Teams. But really this is going to be a way for all of the practitioners of Lean and Six Sigma and continuous improvement to really be able to get to know each other and work together. So that's just a little bit about the Uplands Network. If you have any question, just go ahead and put it in the chat. But now I am very happy to be able to turn the microphone over to Joe Voss. And Joe is going to tell us what they're doing over at Cook Medical here in COVID and how they're dealing with it.
Thank you, Chuck, and good morning to everyone. I'm very excited and happy to be here. And I just want to thank the Upland Lean Network, along with the Wabash Valley Lean Network, for giving me the opportunity to share a little bit about myself and my company. along with some of the changes that we implemented as a response to the COVID-19. So real quick about me, my name is Joe Voss. I am the Continuous Improvement Manager at Cook Inc. I started my continuous improvement career back in 2003 as a consultant, implementing continuous improvement based on the philosophies of the Toyota production system. And I've been doing some form of continuous improvement for almost 18 years now. I started with Cook 5 years ago as a production engineer, and then I joined the CI team in January of 2019. So Cook is a medical device manufacturer that was founded in 1963 in a small apartment here in Bloomington, Indiana. At Cook, we invent, manufacture, and deliver a unique portfolio of medical devices to the healthcare systems of the world. And we currently provide products to 135 countries and employ more than 12,000 employees globally. So as part of the healthcare industry, the challenge that we faced was figuring out how to maintain our commitments to our customers and the patients, but still keep our employees safe. Our initial response to COVID-19 was probably pretty similar to what other organizations experienced. We immediately identified essential personnel, which included manufacturing, and then a skeleton crew of operational support, and we asked the rest of our organization to start working from home. Over the next several weeks, we implemented multiple countermeasures to include temperature screenings, physical distancing of 6 feet, Lexan barriers between workstations, and many more things. Once we implemented some of these countermeasures, we were able to bring more of our operational support teams back on site. So after our initial response, we realized that we needed more space so we could promote better physical distancing, specifically in our manufacturing environments. So we deployed a simple lean tool known as 6S to help us address our space constraints. Our business case was to deploy a 6S initiative to free up space in manufacturing and in our office environments to allow for physical distancing and to promote safe, clean, and efficient work environments. Next slide, please. So we had two main groups focused on this initiative. The CI team was focused in manufacturing and worked with over 60 manufacturing teammates to deploy 6S in 64 different departments, resulting in multiple big ticket items such as desks, racks, cabinets, and chairs being removed out of production, which freed up a lot of much needed space. In addition to the efforts in manufacturing, we had an ops support facilities group, which was focused in our office environments, and this team just really did a great job freeing up space. And the results we achieved are pretty amazing when you stop and think about it. We freed up nearly 75,000 square feet of space that is currently being converted back to manufacturing space, which will allow us to move some of our product lines around and has really helped us promote better physical distancing in manufacturing. We're also able to rearrange our office environments to promote physical distancing for our on-site employees. And we added flex desks for our teammates who are working off-site but need to come in from time to time. These massive physical changes to our facilities, along with the ongoing efforts to maintain safe working environments, have really laid the foundation for our long-term thinking around how we will do business in the future. That should bring me really close to my allotted time. And again, I just want to say thanks to everyone on the call, and I look forward to your questions a little later. Next up, it's my pleasure to introduce Mary Burday from Indiana University.
Hi, good morning, everyone. My name is Mary Burday. I work in the Office of the Chief Financial Officer at Indiana University. We have a group of people who work on lean process improvement, and we have been at it for about 5 years. I am a director of process improvement in that capacity. And so I've been at it. I'd like to say I've been lean my whole life because I think it's just the way I think about things. But in terms of officially practicing lean, it's been about 5 years. So thank you. So I wanted to talk a little bit about what we're doing in terms of lean in the Office of the VP CFO. So this is not an institutional initiative. This is within our organization. And we have a couple of different things that we do. We have a committee of folks, and it's completely voluntary. It's not anything that's been mandated or directed, but it's a group of people who are very interested in lean and in process improvement. And so every year we select some big projects. A lot of them have institutional impact, so they might cross all of our campuses, as well as different functional organizations. And we work on these projects. And outside of that, we also offer consulting and training. So we have a set of training classes that start with an introduction to lean all the way up to developing lean leaders. And those are available to anybody within the university who's interested in taking them. We also, I also provide consulting, and even some of the folks within our committee who are experienced lean practitioners, they might go out and help a group of people work through some of their process improvement. But I also do consulting with different units within the organization. So for example, last fall, I wrapped up a project with the chemistry department. I've also worked with the student health center. So it's really anyone who has a process that they want to take a look at. Why did we start this? Well, our CFO came to us from Notre Dame, and they had a pretty robust process improvement culture. And he really saw the advantages and the improvements that they made there. And so he thought, we should get something started. But for all of the reasons that Doug mentioned before, we want to do the best. We want to provide the best service to our customers, and we're increasingly facing budgetary constraints. We have an enrollment cliff that we're facing in terms of incoming high school seniors. The number of seniors that's graduating is going to be greatly reduced within the next couple of years. And then state appropriations are becoming more and more constrained. So we're having to do more with less, but we still want to provide the best world-class research and education that the university is known for. The picture there, for those of you, that's some of the folks on one of our committees. And we took a trip to the Toyota plant in Southern Indiana, and they were nice enough to take a picture of us. And we're constantly learning and evolving and honing our skills. And I just thought I'd share a picture of that. So next slide. So university setting is probably a little bit different. So I wanted to describe some of the complications that we face due to COVID. First of all, we're a pretty complicated organization. We're spread out across multiple campuses. We have a lot of cross-functional processes where we have silos of responsibility, and yet our work impacts each other, and it makes it really complicated. We have responsibility center management, which often results in different priorities. So different organizations have their own budgets. They have their budgetary objectives. They have their organizational objectives, and sometimes improving processes that cross these organizations can be very complicated. And we also have a culture of meeting in person. We're a college, and we have a very collegial environment. We like to meet in person. We like that one-on-one contact. But we've also been around a long time. You know, last year was our bicentennial year. When COVID hit, it was supposed to be a year of celebration, but it ended up being the year of COVID. And so we're really kind of slow to change. And all of these challenges that we face in terms of process improvement were amplified by COVID. So how did we address that while continuing to focus on process improvement? So can you go to the next slide? So most of our work in the office of the CFO is it's finance related work. We have the Bursar function. We have the office of the controller. We have purchasing. A lot of the work that we do is on computers. So we really zoomed a lot. As soon as COVID hit, we all started working remotely, which I don't think we ever anticipated would happen. And I think we didn't anticipate it was even possible. And we are all continuing to work remotely. I'm in my dining room at home right now. And so we've had to use Zoom a lot. I think we're all a little bit tired of it. And we've just really started to learn all the functionality that we can use. We use breakout rooms. We get big meetings of people together, and we want to focus on different topics. So if we want to focus on, what's the impact to the customer, and another group wants to focus on what's the financial impact, we'll use breakout rooms and get people together to talk about things and then bring them back together. So we use those a lot. we've used, real-time document updating. So everybody can see it. That's how we're taking notes. Everybody can see what's going on constantly. And we have our standards for engagement that we've set out. Within Zoom, we've also started to use the whiteboard functionality. We looked at some outside services, but we found that Zoom works fine. And so we've used it for things like brainstorming and, kind of reorganizing into affinity categorizations. And you can see a screenshot of one that we actually did in training. It's tricky, but it works. So we can still do the old-fashioned lean brainstorming where everybody kind of silently jots down what they think. We've also used Visio in real time for process mapping. We can't get 15 people into a room together anymore and use the giant piece of paper and sticky notes. So we pull up Visio, and it's painful and it takes more time, but if you have your shapes ready and you can just kind of drop them in, everybody can see. And so we've been able to do process mapping using Visio in real time. And of course, we've used a lot of other things like file sharing. We've opened up our calendars so we can, be more effective in terms of scheduling meetings. And we've actually created a lean toolbox for our committee. And we've been working on this a long time, but I think COVID actually caused us to actually kind of finalize what's going to be in that toolbox and make it available to everybody. So, so they have everything that they need in one place. It's been kind of tough, but in the spirit of continuous improvement, we've tried things, and as we've kind of either failed or not failed, we've kind of tweaked them and enhanced them and gotten better. So we've made it work. And next slide, I think that might be it. So let me introduce, so that's kind of how we've taken our computerized work and made it virtual. And I'd like to introduce Chuck Russo from IU Health now, and he's going to talk about what they've been doing.
Well, thank you so much, Mary. And what a great presentation from Joe and Mary, and what a great kickoff from Doug. Always love to have that intro to lean. We are educators as well as improvers, and so it's always nice to have a little bit of education. Such great work at both Cook and IU, and you're going to see a lot of the same themes as I run through a few slides just to talk about what we're doing at IU Health. Next slide, please, Andy. Just a little bit about myself. So I am the Transformation Director at IU Health South Central Region. I'm an engineer by training, chemical engineer. You can see how old I am if you look at the year I graduated from Notre Dame. Spent quite a few years in the chemical and plastics industry, then moved to the printed circuit board industry, then to the medical device industry. And I like to say I came home to IU Health in 2014, and it's been a real joy working in healthcare for the last 7 years and really being able to apply a lot of the principles that we know work so well in every industry. And really my intro to lean happened back at GE back in the early 90s. And so I've been fortunate to be involved with Lean, Six Sigma, continuous improvement for almost 30 years. And we are based at IU Health. Really, we use the principles of the Toyota production system as the backbone for our efforts. Next slide, please. So I got a few, a lot of pictures, and I just kind of want to show you what it looks like. What it used to look like was we used to do our continuous improvement, what we call rapid improvement events, in conference rooms. We'd be close to the Gemba where the work gets done. We now do almost everything virtually. That's just an example of one of our recent meetings where we had some fun with hats. So we're using Zoom, WebEx, and Microsoft Teams extensively in our current configuration. Next slide, please. So we have about 5,000 team members in the South Central region of IU Health, and about 650 or 700 of them are working remotely. So that's about 12% of our workforce. So that has allowed us to do a lot of interesting things with space. Probably my favorite thing that we've done is we took the transformation offices on First Street in Bloomington and converted it into a COVID vaccine clinic. And so we're very proud of the utilization of that space. Next slide, please. So what does visual management look like? Visual management in the pre-COVID days, we used to use the walls and flip charts and Post-it notes pretty extensively. We like to say that we kept 3M in business for quite a few years. Really, we have evolved now to lots of virtual tools. We really like the Microsoft Planner function. It's a really nice way to kind of take all of your projects and create a little portfolio management approach. We're using Power BI a lot. We use Smartsheets a lot. Lots of other tools like that. Basically to take what used to be on the wall and make it visual in a virtual environment. Next slide, please. So, we really worked hard to stand up what we call Managing for Daily Improvement, or MDI, and kind of create a culture of daily huddles in our region and across IU Health. If you look at the left, that's kind of our standard template board that we used, and we still use for our team members that are meeting on site. We're also, though, doing a lot of virtual huddles, and we use Microsoft Teams and other methods for doing that. Next slide. So we really made a pretty significant transformation in the way that we do our facility-wide huddles. We call them our DASH huddles, Daily Awareness and Safety Huddle. Used to be, we had a whiteboard, and we've really now utilized Teams where everybody is huddling in their individual facilities at 9:05 a.m. We've got about 400 people that are collaborating and utilizing Teams to do their updates. And then every morning at 10 o'clock, our executive team huddles, and we review all the results from all the different locations in real time. And this has been something we didn't do before COVID, that we're now doing very effectively since. So I would have to say, and I think it sounds like it's very similar from Cook and IU, I would have to say we're probably more effective with continuous improvement and lean now than we've ever been. And that's just an example of what our daily DASH report looks like. Next slide, please. So now I'm just going to kind of talk to just a tool that we've adapted over the last few years. We call it a paper doll exercise. We started, actually Dave Takid, when she was at IU Health, was the first person who did it. And we did it all in a big conference room on the wall. And now what we've done is we just use Microsoft PowerPoint, and we utilize the paper doll methodology just for us to be able to look at the flow of patients, families, and staff in an area. And so this is what it looks like. And Andy, if you want to just kind of scroll through real quickly, what you're going to do is you're going to see patients move from coming in the door, moving into the pre-area of the OR, going to the OR, coming out of into the post area. And then we'll have some patients that would need to spend the evening in the overnight recovery unit, which is what we're going to be putting into the RAHC. We really are basing this on an actual day of surgeries and then modeling it out. And we've just opted to use PowerPoint. It's real easy to use, and you can see just virtual Post-it notes. And so this is really a way that we can take the work that we used to do in the Gemba. We still have to go to the Gemba. We've got to go out and see how the work is actually getting done. But this is just a real easy way for us to organize that effort and do it in a simple virtual format. So that's the update from IU Health. And now what we did when we developed the agenda for this morning We wanted to leave a lot of time for Q&A and for discussion. Really, as we'll talk about, this is really a way for us to get to know each other and to network and to help solve problems together. So we want to make sure we leave plenty of time. So I'm going to turn it over to Andy and Doug for the Q&A.
Well, we've got questions coming in fast and furious. Plus, we've had some that people sent in earlier. So I'm just going to start. Here's the first question for the panel. So a lot of organizations have people who are administrative. You know, they're used to working on computers. They've got offices and desks and are familiar with Zoom. And then frontline folks. Think of production folks out in the shop, in retail space. The people doing the checkout. Nurses, med techs, firemen, policemen, the frontline folks who may not have access to the same technology. How do you coordinate continuous improvement efforts between those two different groups? Anybody want to take it?
I mean, our main focus has been in manufacturing right now, but I can speak just generally based on my past experiences that you still look at the processes that are being completed, like even inside of office work or administrative type work, there's a system and a process that's driving that type of work. It kind of goes along the same lines as the quote that you shared, Doug, about understanding what you're doing. If you can explain it, then you have a good understanding of what the process is. So in my past experience, I've actually mapped out using the same type of value stream mapping tools and just the different lean thinking to look at any type of work that you're doing and to identify waste and remove that and help streamline the process.
So we don't have the kind of manufacturing side of it, but we're all office work really in the office of the CFO, and we use the same tools. You know, we structure the project using our SIPOC, we process map it. I mean, paying a Bursar bill or applying payment for a Bursar bill, it's still a process. So you're looking at it might be paper flow, it might be flow of information, but they're still part of a big process. So we use the same tools.
Yeah, I think at IU Health, we have a combination of operations. You know, our operations are hospitals, outpatient services, clinics, but we also have office-based processes. We use the A3 methodology and also the PDCA methodology. We process map every process really before we dive into it, and we find that, you know, the A3 process mapping works really well in either environment. I think that you know, we'll certainly have a chance to talk about process mapping in a future meeting, but really being able to do that, kind of looking at where you are now in your current state and where you want to be in your future state, helps us to kind of bridge that gap between actual operations and office processes.
So a common theme here we're getting a lot of is what's your long-term plans for letting people work from home? You want to all three give a quick answer to that?
Yeah, I think we're going to continue to look at that, and the way we've set up our new office of environment is promoting people working from home. We have the flex desks that people can basically reserve like you would a hotel room kind of to come in when they need to, but we will definitely probably continue to work from home when people can.
So these are conversations that we're having. We actually were starting to talk about remote work before COVID hit. And of course it forced us, fortunately, we all had great contingency plans because it forced us to all become remote immediately. We're actually in the process within the BPCF organization of looking at what our space needs are, at least for the teams that I work with. it looks like some of the teams were going to go to halftime virtually, halftime on site. And so instead of everyone having a desk, we're going to have desk sharing in some situations where half of the team is in one day, half of the team is in the other day. So we don't need as much space. We're really doing that on a team by team basis. Some teams really probably need to be in the office all the time, and other folks maybe really don't need to come in at all. So it's having a tremendous impact in the way that we're approaching coming into the office.
I would say that, our approach is going to be very similar to what Mary just mentioned. We went through and did a survey a few months ago of all of our team members. Do they work on site? Do they work exclusively off site? Because we had a few of those before COVID, not very many. Will they come back on site when kind of we're ready, or will they work a hybrid? And so we've kind of walked through that. But I think there's no going back to the way it was. We know that we're going to move forward, and we've seen efficiencies with space utilization, with office rentals, and just with collaboration that we intend to continue with at IU Health into the future. Of course, many of our operations, patients, that go to the hospital need care in the hospital with people there. But then a lot of other things that used to be face-to-face, virtual visits are now really climbing, and the percentage of virtual visits that we're doing is going up pretty significantly. Turns out patients really like certain visits to be virtual, that it's a really good way to get care. So I think we'll return to the office environment, but never back to the way it was before.
Hey, Doug, if I can pop in here real quick too, just from our perspective at the mill as being a co-work space, we have seen since we reopened in June, net member growth month over month. So we've lost some folks, but we have gained folks as well. And we are seeing more and more people who, because of reduction of office footprints and wanting to not necessarily work at home and be in a more professional type setting, the number of folks who are getting even part-time memberships climbing here at the mill. And so I think we're expecting that as things are open up, maybe a little bit more further into the year, that we'll be back at capacity where we were pre-COVID.
Awesome. Great answers. Well, since we've got such a great panel here, I'm going to keep you on the hot spot here a little bit longer. So, this COVID thing's been tough on all of us. How have you handled morale problems? People have lots of things going on in their home life now that they didn't have to worry about. Work is certainly different than what it used to be. Have you had morale problems, and how have you dealt with those?
So yeah, I'll be happy to take that one and be the first. So we've actually seen our team member engagement go up since COVID, and that has been really a lot of hard work from our leaders at every level, spending a lot of time with our team members that are working on site and really connecting with those team members that are working remotely. We know we're seeing more and more behavioral health needs across the country. We see it very much at IU Health every single day. But for our team members, it's been a chance to really reconnect with them on what do they need, what matters most to them, and how can we really serve those needs.
So going
Mary,
back to the
you
responsibility.
want to
Oh, go ahead. Sorry.
chime in on that one, or go to the next one?
Well, I just wanted to chime in. I mean, going back to the responsibility center management, it's pretty hard to understand what's happening institutionally, but within our organization, we've again used Zoom to just kind of reach out and connect. Every organization is kind of working on it in their own way in terms of keeping people engaged. But I mean, we know of folks having kind of, virtual coffee times. I mean, my team does a weekly coffee talk where we just get together and we have a topic of the week, but it doesn't have to be that. It's not work related. And we just chat and kind of re-engage as people, so that we can remember that we're not just coworkers. So it just depends on the team, but we're trying a lot of different things.
Yeah, I would just add that, and it goes along with what both Mary and Chuck has already said, but just being transparent, communication, people engagement. I mean, just things that we want to do in general from a continuous improvement perspective, I think goes a long way. Even when something like this happens, that's not predictable or unprecedented. It's just keeping people in the loop on what's going on. And in our industry, it's kind of a little bit easier because of how important we are, just to the response of something like COVID. Like, we make medical devices that help treat patients that are out there. So it puts a little bit of emphasis on the importance of our jobs and what we do and how we're supporting this pandemic. So.
Okay, now I'm going to take a step out here and try to put a positive twist on COVID. So of all these things you've done differently now, what will you keep in the future? When the pandemic's gone, what will you still be doing that you started that was sort of forced on you?
For Cook, it's probably working. The people who are able to work from home will continue to work from home. I see that going on for quite some time. It's interesting because before that, we actually would have like town hall meetings or meetings with the president of the company, and this was a topic that came up quite a bit. Like, do I have an opportunity to work from home? And so this COVID-19 has kind of opened up that door for some people, and I think we'll continue to do that.
I think at IU Health, we'll never completely go back to the way we worked before. Used to, we don't have to travel a lot because we're an Indiana-based company. But a lot of trips to Indianapolis. What we've found is that for most of those, a virtual meeting works great. We get time back and we can still collaborate really well. So I anticipate we're going to have a lot more virtual meetings even when COVID is behind us and we go back to the work environment. The other thing I would say is what we found is, took us a little while, but what we found is we can collaborate and work on continuous improvement just as well in this environment as we could before. We just have to change our mindset. And as we've changed our mindset and we've started to say, let's try whiteboard, let's use PowerPoint, right? Let's use Teams or whatever it is that we find out that we can adapt to the new reality that we live in pretty well.
Yeah, I agree with what Chuck just said. Having the mindset to adapt is critical. As I said, I don't think we're ever going to go back to the regular coming into work every day model. But I also think that because we do have this culture of everybody, traveling across campus and sometimes driving down from Indianapolis to attend a 2-hour meeting in Bloomington, I think that, I think a little bit of that will still go on, but I think that these virtual meetings are here to stay. A lot of people feel like they have more time because they're not packing up their things and walking across campus for a meeting and then walking back. They can work up until the time of the meeting, jump on the meeting, and when they're done, they're back at their desk. So I think these virtual meetings for this kind of thing are here to stay.
Let's try to get a couple more questions in here yet. It got pointed out that we sort of stacked the panel with folks from large organizations. So any advice you guys would have for small companies?
I've worked with several small companies in my past, and even in the large organizations, like you still want to start in a small area anyway to kind of get an understanding of how these tools and how the thinking and you're developing the methodology for your organization. It might be based off of Toyota's philosophy or some other lean initiative that you have experience with, but you want to still start off in a small area. And I think you could be really successful just by focusing in a small and important area of your business before you start spreading the lean thinking out throughout the entire organization. So just because you're small, I think you can still pick one little area that you want to develop some of the tools and methodology around, and then deploy that throughout the rest of your company.
Yeah, I would say before I came to IU Health, we got about 35,000 team members statewide. I came from a little medical device startup with 8 people. And I would say the same thing, you know, start real simple, use a couple of the methodologies, and just get started. You know, I think 6S is a great way to start. I can't say enough about 6S as a way to get started in an organization of any size, really. I also saw a question about making daily huddle work, and this is something we really had to adapt because we were very much of a, you know, have your MDI board on the wall. And what we found was we could just do some things in Teams. We created a little template in Teams that we just broadcast virtually, and it's real easy for people to get in there and multiple people can update it at the same time. We've also used Excel, and Excel works pretty well as well. We basically took our MDI template and just duplicated it in Excel. And again, you can really use that collaboration function to have pretty good interactive daily huddles.
I would
So,
liken
You're doing
working with.
differently.
Oh, go ahead.
And you know, I'm sorry, Mary, you gonna answer that?
Oh, I was just going to say, I would liken working with one of our departments is similar to a smaller organization. It work with them to identify a good project to learn on, and then and make sure it's going to be something that they can learn how lean works. And I try to find something that's going to be generally successful. Don't bite off too much. And once they work through the process and see the success, they're going to want to work through the process again. They're going to start identifying other areas. We've had really great success with spreading lean and just kind of teaching lean that way.
So, you know, we in the lean world love to measure things. So do you have any measurements that showing that working in this virtual world has been more effective or less effective or no change when it comes to project completion and measurable improvement results? Do you have any measurements that was pre-COVID to today?
So I can speak to kind of the way we measure our key metrics at IU Health. We have something that we call a promise dashboard, where we're measuring kind of patient harm, reducing mortality, improving team member engagement, improving patient experience, and making good on our ability to fund the business. And we were green across IU Health on each of those metrics in 2020. So we were able to get results in the difficult environment. Within the South Central region, we completed about 100 continuous improvement projects in 2020. So we feel like we were able to continue to make improvement happen, even in the hybrid world that we currently live in.
I would say that we probably didn't do a very good job prior to COVID. And we're just getting started on our lean journey. So we're probably about 2 to 3 years in, but I do know in 2020, like we did focus on a lot of different manufacturing type continuous improvement projects. and there was a lot of attention and focus on those, and we reported out on those weekly with upper management. And I think because of that ability, and that was all done via Zoom or WebEx Teams calls, and because of that focus, we were able to get a lot of those projects across the finish line. But there's really nothing to compare it to prior to COVID, because we weren't really tracking things like that, or didn't have that focus. But it's something that we'll continue to do in the future.
Yeah, I can't say that we've seen an improvement or a decline in the results that we're getting. I will say that it does take more time and discipline. And I think part of that's a learning curve with going virtual. In terms of actually getting through the projects and doing the work, that's actually taking a little bit longer, I think. But we're not seeing a difference in the outcomes when we complete projects.
Great. Well, you know, this MC gig doesn't pay very well, but it does have one benefit, in that I get to ask the last question to the group. So you've got 100 lean practitioners and lean leaders online with us here, and I'd like you to give them your best actionable advice that they could take and maybe think about something differently, do something differently when they leave this meeting. Now, the kicker is you got 1 minute, because that's really all the time we got left. So in 60 seconds, what's your best lean advice for the folks that we have online with us? Mary, you're on the screen. Take it.
Okay, well, so I was thinking specifically in terms of COVID. So I actually jotted them down in advance. So first of all, don't give up on lean. We were so diverted by the pandemic that we basically put a pause on lean for a couple of months. We couldn't get to it. We had so many other distractions, but we just kept saying, okay, is it time? Is it time? And we refocused. And we got back to it. So don't give up on lean. Keep looking for new or innovative ways to use your tools. I mean, we tried that whiteboard multiple different ways. We had bad results, and finally we found a way that we could get it to work for us. And disruption does not exclude innovation. Don't allow something disruptive to stop innovation. In our case, the fact that we're going to rethink how we work in the office has been a tremendous change for us that I think 2 years ago we never would have anticipated. So disruption can go hand in hand with innovation.
Joe?
Sure. Anybody that knows me knows that I'm a huge person that believes in people development. And I think if you can focus on working with the people within your organization to develop their capabilities to identify and solve problems multiple times a day, then you'll have long-term sustainable results. And that's really what we're after when we're doing our lean initiatives and things like that. So focus on the people, go to the shop floors wherever they are. That could be in the office environments, and understand where the struggles are that they experience every single day. So work with the people, empower them to go after the issues, and utilize some of the tools to help you do that.
And last but not least, Mr. Russo.
Thank you very much, Doug. So I would say a lot of similarities to both Mary and Joe, and that is, even in a remote world, especially in a remote world, connecting with people is so important, and really being able to find a way to identify what those problems are, use our continuous improvement tools, whatever methodology we're using to solve those problems. The other thing I would say is to really use this opportunity to think outside of the box, think about a different way of doing things, because I do think that necessity is the mother of invention for all of us that are continuous improvement practitioners, and to really try not to be deterred and think of a different and potentially better way to do it than the way we used to.
So I want to say a big thank you to all of our panelists. If we were here, we could give them a resounding round of applause, but they did a great job here talking about some of the problems and some of the workarounds they've done with the COVID-19 virus. Also thank Andy Lehman and the mill here in Bloomington. If you've done multiple location Zoom meetings, you know that's not easy, and Andy's pulled all the levers and hit the buttons to make it all pretty seamless there. So thank you to Andy. We've got another meeting coming up in a couple of weeks as part of Wabash Valley Network that you'll all be invited to. Carl Ulrichs, who's wears a lot of hats and a lot of talents. We've had him at Wabash Valley Network a number of times. He's one of the most popular speakers there is. He's one of the hats he wears. He's a professional speaker. He's usually in Vegas or New York City or Miami at those conventions that cost $5,000 a day to go to. But we're going to have him with us in a couple of Thursdays from now, March 4th at 9 o'clock. So the title of his talk is Making Tough Decisions in a Lean World. Carl puts a interesting spin on lean. He ties in current events. He'll talk about the new abnormal, as he calls it, ethics, psychology, and maybe a little Greek mythology. So certainly, if you've heard Carl before, you know how good he is. If you haven't heard him, make sure you tune into that one. Chuck, you want to say a little bit about anything else about your next meeting?
Sure do. Thank you so much, Doug. So our next virtual meeting will be Friday, April the 16th, 11 a.m. to noon. So bring your lunch with and enjoy the presentation. So actually, I'm going to be talking with some members from our leadership team about the IU Health Lean journey from 2013 to the present. The other thing that we're going to be doing in the next meeting is we're going to have lots of breakout time. Probably half of that time is going to be breakout time. We really want to get people to be able to meet each other, interact with each other. So we'll be using the breakout format in Zoom to be able to do that and to be able to discuss kind of what are our things that are going well and what are the opportunities to improve. So we really look forward to seeing you on April 16th. We also invite you to join the Wabash Valley Lean Network virtual events as well. So we are coming right up to the top of the hour to noon. And so I just want to thank everybody for joining us. And we look forward to meeting virtually in April, and hopefully before too long, we'll be able to get together face to face.
So I'll just quick close. Thanks again for everybody. It was a great meeting. Thanks for logging in and being with us today. There's great meetings coming up in the future. As they used to say in the 50s, be there or be square. Think about joining Wabash Valley Lean Network. There's not a better group of people you can surround yourself with. So until next time, adios.